5 red flags that you need to be aware of when looking for a dental associateship. In this video, I will focus on my experiences that I have had with dental offices. It's not meant to scare you. It's not meant to be unprofessional. These are things that have happened to me, and all I want to do is warn you about it. I'm not trying to generalize these situations to all offices. Every office is different. Every experience is different. Everything is not always bad. I'm a positive person and I like to look at things in a positive perspective. For the sake of this video, I'm going to focus on my experiences and share them with you so that you can potentially avoid these same situations. The daily minimum. This is the amount of money that the owner agrees to pay you per day of work at minimum. I believe this is an absolute must if you are an associate. This number for me ranged anywhere from about $500 to $700 a day. The daily minimum can be a polarizing subject between associates and owners. That being said, that doesn't mean that it's wrong or not needed. In fact, the conversation about the minimum is always needed. My take, the point of a daily minimum is to guarantee you as the associate a set amount of money that you know that you will be able to take home with you that day, regardless of how busy the practice was. This is to ensure you, the associate, who has hundreds of thousands of dollars in loan debt, as well as regular bills that they have to pay, the financial flexibility and freedom to be able to come to work and focus on work and not have to stress about the financial aspect of things. It's a very simple ask. I don't think it's unreasonable. The other reason why I think it's necessary is because it keeps the owner accountable and involved in making sure that you succeed. If the owner has to pay you a certain amount of money per day to work, that means that that is a cost to them. So if they want to make money off of that, it is in their best interest to make sure that you are a successful dentist, so that way you can produce over that amount of money, so that way you are happier as an associate and the owner is also happier. This is how it should work. Number 2, the owner is filling your schedule with procedures that they don't want to do. During the interview process, you need to ask questions to make sure that you know exactly what type of situation that you're getting yourself into. I plan on making a video about interview tips. If you could please drill that like and subscribe button so that way you don't miss it. I will link the video when it's ready. When you ask questions up front, you're gonna have a better idea of what to expect when you take this job. Some offices need associates to come in and take the workload off of the owner because they are so busy. This is a good thing. Some offices want an associate to come in and just do restorative procedures because the owner is focused on surgery. That's also fine, but you need a heads up to know that before you go in. The reason why I say that is because if you don't know that, you could be walking into a situation where your potential for growth is severely restricted. If all you're doing are restorative procedures and you don't have the ability to expand your procedure code, then that is going to limit you as an associate and what you can achieve. Some people are totally fine doing just restorative dentistry, and that's okay. That's why I said you need to ask and know these things up front. Point is, if you don't know what the situation looks like, the owner could easily just dump procedures onto your schedule. You may look busy, but you won't be productive. So it's always best to have a clear and open communication with the owner before you take the job to ensure that you don't fall into this trap of having the unwanted procedures fall and fill up your schedule. Number 3, they are super desperate to hire. This can be a good thing if they have a super robust patient population and they need help ASAP. Now, here's an example of why a desperate owner is a bad thing. This is a personal experience for me. I don't know how common it is. Again, I'm just trying to share so that way you're aware of things that can happen. Story time. So, I was being pursued by an owner to take a job as an associate, and the interview went fine. Everything looked like it was lining up perfectly. But then as I was taking my time to just kind of evaluate my options, the owner was aggressively pursuing me, kind of rubbed me the wrong way. So I backed off. I ended up not taking the job and I looked elsewhere. But what I found out 3 months later is that owner ended up hiring a different associate And then that owner actually left the state and sold the practice and left that associate out to dry. That was a super weird and strange situation. But my advice is, if anywhere during the interview process something feels off, go with your gut, because you're probably right. Number 4, not being able to talk to the previous associate if you are replacing one. You need to know why you're replacing an associate. Best case scenario, you're replacing an associate that has super busy, productive schedule, and then they just had to move for life reasons like getting married or other things unrelated to the dental work environment. It can be very, very bad if you're replacing an associate because of issues that they had in the practice. So how could you find this out? The best way to figure this out is to just ask the owner if you could talk to the previous associate because you had a couple questions about the job. If the associate left on good terms, the owner will not have a problem giving you their contact number so that way you can ask them questions. I know this because this has happened to me. I have called a previous associate, I had a great conversation with them, and that was a job that I actually took that I liked. If the owner says no, well, that usually means that there was something that happened. So err on the side of caution if that's the case. But know that if they're not super willing to give you that option to talk to the associate, something probably happened. So tread lightly. Number 5, being the first associate that an office hires. This opens you up to a lot of potential problems. I'll go through a few of them. 1, the patients just want to stay with the owner. They've never seen an associate. They don't know who an associate is. They don't know who you are. They don't care who you are. You look young. You look like you don't know what you're doing. They don't want to see you. What does that lead to? An empty schedule for you because all the patients want to stay with the owner. If you want to know how to navigate those situations, let me know in the comments. I have a couple tips that I can share. I'll even make another video about it. But very real situation and very, very common. Another thing, pretty simple. The staff and the owner may have no idea what to do with you as an associate. They've never had one. So it's like getting the shiny new toy and you're still figuring out how to play with it. That's how these offices are. Like if they don't know or have had any experience, you're gonna be the trial run. And know that with being a trial run, you are gonna have to go through experiments with them. So that is not efficient for you and is going to delay your ability to grow in an office. There are a few golden opportunities out there where you can be the first associate. This is heavily dependent upon if the owner and the office actually know what they want out of you and have the ability to support you. Ask the right questions at the interview and you will likely be able to figure it out. I can include those in my interview tip video as well. Just let me know in the comments below. I hope these helped. Please, if you enjoyed the video, drill the like and subscribe button. Leave comments below with any feedback that you have, anything that you want to hear more about. I make these videos for you guys, so any feedback is appreciated. Thank you.